Hello, I'm Reagan Billings, Health and Performance Coach at Tiger Medical, and today we're going to be talking about 5 things to consider before buying a preventive medicine program. There's a quote I'd like to start with from Rita Mae Brown that says, "Good judgment comes from experience, and experience comes from bad judgment." So all that we want to do today in this video is give you 5 things to consider so that you can have great judgment when you're evaluating preventive medicine programs, and specifically our program too. The first thing to consider pretty much when evaluating anything that you are about to purchase is price. So we want to be very transparent, clear, and honest here at Tiger that preventive medicine programs usually are an out-of-pocket cost and may not be covered by insurance like many traditional medicine programs. There's a lot of different pros to this. There are some definite cons. The immediate con is that it can be a bigger hit on the wallet, but here at Tiger, we want to be very transparent about this is what we do and this is what it costs. So you can see clearly listed on our pricing programs on our website, these are our options and this is what it costs, so that there are no hidden sales calls, no trap sales calls, nothing like that. Simply, this is what we offer and this is what it costs. All right, the number 2 thing to consider is healthcare administration. For example, when my wife and I are deciding where do we want to go and eat dinner on date night, she does a thorough review of Yelp reviews. She wants to make sure the food's going to be good, other people like it, that we're getting our money's worth for the meal, and that there's qualified people making the food. This is maybe a bit of a stretch of an analogy, and Tiger Medical is not on Yelp, but it is important to consider who is in charge of your healthcare when joining a program like this. Fortunately at Tiger, we take great pride in having board-certified physicians who are trained uniquely in root cause medicine so that you can ensure you're getting the best and most knowledgeable care in our program. The third thing to consider when evaluating preventive medicine programs is the duration. Most preventive medicine programs are not quick fix, short-term, immediate solutions to your symptoms that maybe you've been dealing with for a very long time, but typically preventive medicine programs take a root cause approach and take a very holistic approach to the individual as well. So with this, it can take time for the testing and implementing different things to see the results. And that's why at Tiger, we have our program initially set up for 1 year. Piggybacking off of duration, the 4th thing to consider is patience. And that's patience, whether you have patience or not, for a longer term root cause focused program. So we encourage our clients to have patience, of course, as life circumstances happen and things come up, whether sometimes people fall off or maybe are not as consistent due to work circumstances, holidays, etc. We want to have patience, and you want to consider your own level of grace or patience for yourself when looking at preventive medicine programs. Finally, we've arrived at our 5th thing to consider for preventive medicine programs is commitment and courage. As we just talked about, it takes time and patience when going through a program like this. So just ask you to consider your level of commitment right now. Are you willing to commit? Are you able to, or are you unable to due to various life circumstances? As well as having courage to do this. That's something to consider. It does take courage to potentially greatly change your lifestyle for better health and optimization. So that is why we have this point here at the end. So our takeaways for today are those 5 things that we looked at to consider when evaluating a preventive medicine program. And so the first thing is the price or cost. Maybe not only the cost to your wallet, but also the margin of your health. Can you keep getting by with the status quo, or is it time to take the next step and schedule a consultation regarding a preventive medicine approach? And then the second one is who's in charge of your health, the duration of the program, patience, and then finally, the commitment and courage that it may take to complete a preventive medicine program and see the results that you may be looking for. Thank you for watching and listening today. If you have any questions, feel free to reach out to us at Tiger and we'd be happy to answer them. Enjoy the rest of your day.